Afternoon, everyone. I am Dr. Bhakti Parmar, and it's my utmost pleasure to welcome you all to one of a kind seminar. Cinematographic screening of a dentigerous cyst, brought to you by a tumor in proud association with the Practicing Oral Pathologist and Microbiologist Association, which is Popma. So, we are delighted to have a wonderful group of dental students, interns, professionals joining us today. So, whether you are here to refresh your knowledge or explore new perspectives, we hope today's session offers a real value. So, guys, you are not just attending another dental seminar. Oh, really? No. You have stepped into a space where imagination fuels education and where a cyst is not just pathology, it's a part of a cinematic journey. So, we at Tumur believe that learning does not have to be linear and boring, it should be emotional, memorable, and yes, even a little bit magical. So, quickly, I will introduce you what is Tumur. Tumur is the flagship product of Varka's Research and Innovation Private Limited. Tumur is the world's first fiction-based learning application for head and neck pathology, offering learning programs with a unique blend of technology, content, and pedagogy. So, at Tumur, we aim to present the most complicated, boring, and difficult to remember tumors and pathologies in various characters and avatars that will have the lasting impression over the minds of students. This is for the very first time that the pathologists portray heroes and heroines, whereas pathogenesis is the story which gives an immersive and engaging experience to not just the students but to anyone who want to know these pathologies. So quickly I will introduce our esteemed keynote speakers for the session. Dr. Durga Prasad sir, he is a guest of honor. He is a dean at Malla Reddy Vishwa Vidyapit School of Dental Sciences and Technology. A warm welcome, Dr. Durga Prasad sir. Dr. Bhuvan Nagpal sir, he is a renowned oral pathologist and president of Popma. Dr. Ketki ma'am, a dynamic oral pathologist and managing director at Varka's Research and Innovation Private Limited. So we are honored to have such a distinguished minds with us today. So to begin with, I am honored to invite Dr. Bhuvan Nagpal sir, who will briefly introduce POPMA, Platform of Oral Pathology and Microbiology Association, the visionary behind the foundation of this initiative. Over to you, sir. Thank you.
Thank you so much, Dr. Bhakti Parmar and Dr. Ketki, madam. I welcome you all to a new era of dental storytelling, science, and self reliance. A very good evening to all the bright minds gathered here today. It is my distinct honor to welcome you to this one of its kind event, Dentigerous Cyst Decoded, a creative and academic collaboration between Tumor and the Practicing Oral Pathologist and Microbiologist Association, Popma. Today, we are not just hosting a webinar, we are entering a realm where science meets imagination, where the complexities of oral pathology are decoded through the power of fiction based storytelling, and where the students become innovators. So, I want to tell what is all about Popma, our purpose, and our people. Let me take a moment to share the soul of this initiative, Popma. The Practicing Oral Pathologists and Microbiologists Association is not just a professional body, it's a movement. Founded in 2023, Popma was born out of a need to amplify the voice, secure the rights, and strengthen the future of practicing oral pathologists and microbiologists across India. We are a registered association with national presence and a singular goal to make oral pathologists self reliant, recognized, and respected contributors to healthcare, diagnostics, research, and education. And what do we all stand for? For the recognition of MDS oral pathologists as independent lab report signatories and diagnosticians. Policy advocacy to include oral pathology in government health schemes, job roles, and institutional frameworks. Academic empowerment through events like Popcon, that is our Practicing Oral Pathologist Conference 2025, which is going to held in October 4th and 5th of 2025. The Popma study clubs every month event, and now this exciting Tumor partnership. entrepreneurship and innovation, encouraging oral pathologists to lead their own labs, research, and consultancies. Legal and ethical defense of the profession with a strong medico legal wing protecting member rights. Today's event reflects Popma's core values. One, innovation, using animation and fiction to simplify pathology. Education, teaching through immersive experience. Empowerment, a hackathon that encourages students to think like researchers, leaders, and startup founders. Inspiration, presenting a path where dentistry meets creativity, technology, and enterprise. Through platforms like this, we are changing the narrative. No longer are oral pathologists confined to teaching alone. We are building a generation of thinkers, doers, and dreamers. To the students and young professionals, this is your moment, your discipline is powerful, and you are the custodians of its future. Take every opportunity to learn beyond the textbook, think beyond the conventional, and most importantly, believe that your skills can build enterprises and innovations that serve millions. Let Popma be your platform. Let this event be your launchpad. In gratitude, I would like to thank the creative minds at Tumor, especially Dr. Ketki Kalele ma'am and the whole team of Tumor Neuron Institute of Applied Research and Workers for reimagining dental education. I thank every member of the Popma family who continues to support our collective mission. And to each of you present today, thank you for believing in this vision. Together, we are not just decoding a cyst, we are encoding the DNA of a new dental venture. Thank you so much. Jai Hind and Jai Oral Pathology. ओरल पैथोलॉजी मेरा कर्मा, ओरल पैथोलॉजी मेरा धर्मा और ओरल पैथोलॉजी मेरा अभिमान है. Thank you so much.
Thank you so very much, sir, for this enthusiastic and excited words about the Popma and for your words and continued guidance. So, to set the context for today's topic, we will now watch a short informative video that will walk us through the basics and clinical relevance of dentigerous cyst. Please watch closely. It will help spark ideas and questions for our upcoming discussion. So before that, I would like to welcome Dr. Ketki ma'am to preface about video and the presentation.
Yes, hello all. A very, very good evening. First of all, thank you so much, every single person, those who have shown interest in this movement and those who have joined us today on a high tea time of, the Saturday, the weekend. So thank you so much for for all the interest. And thank you, Bhakti, for a great moderation. Thank you, sir, for giving such a great, enthusiastic introduction about the event today. And before going ahead, I would like to say that Tumor is a storytelling format of education. Okay. So, first, we will see dentigerous cyst in a preface form because not everyone out here might have covered in their syllabus the dentigerous cyst, or those who have just take a short glimpse or brushing up of dentigerous cyst characteristics, so that we would be in a better way understand it when we go, when we will go for the cinematographic presentation of it. Okay, so I would like my team, Mr. Ishant, the technical support, to please highlight the preface video of dentigerous cyst. So to all the students in our chat boxes, you can just put the comments about what dentigerous cyst is, what have you understand about dentigerous cyst, if it is covered in your curriculum. I mean, there is no stress here. Nobody is a teacher. Nobody is a student. Okay. Not this one, Ishant. We want a PPT for it to set the context of the subject. The first one, the preface. I welcome Dr. Durga Prasad sir, Dean Malla Reddy Vishwavidyapeeth, Hyderabad, who has joined us. Welcome, sir.
Thank you, Dr. Ketki. I'm audible?
Yes, yes.
Yes, yes, sir.
So we are starting with the cinematographic presentation of the dentager assist, but before that, a short preface. As we all know, dentager assist is the most common odontogenic cyst, okay? And it occurs due to fluid accumulation between the layer of follicular epithelium, which is reduced enamel epithelium, and the enamel surface of the tooth, okay? So this is the basic pathogenesis. Whenever there is obstruction along the path of the tooth, or when there is an inflammatory stimulus stimulating the tooth, what happens? There is increase in the osmolarity or the fluid pressure, and thereby a cystic cavity forms. So this is the basic etiology and pathogenesis, okay? And then we know there are certain basic clinical features like there can be swelling of the jaws, there can be pain in the later stages when it compresses some nerve, or there may be tooth displacement, which is a very, very characteristic feature of dentigerous cyst. Now, this cyst is such a magical one which has the capacity to drive the tooth away from its plane of occlusion to such an extent that the tooth can be seen floating somewhere along the inferior border of the mandible, or even if it is maxillary cyst to the inner side of the orbit also. So that much is the power of displacement that this cyst is having, okay? Then histopathology, we all know that 2 to 3 cell layer of epithelial lining is there, which is the follicular epithelium or the reduced enamel epithelium. And then, of course, there are the radiographic feature is also extremely characteristic. Radiolucency, which is a bubble-like radiolucency along the CEJ of the tooth, enclosing the crown of a unerupted tooth, right? And treatment, of course, is the enucleation, and it has got a wonderful prognosis. It doesn't recur at all. So this was in general about dentigeresis, the key points. Herein we have also seen. So my what to say, my imagination of a dentigerous cyst as a balloon came from, its balloon like appearance, right? We have seen in the images aside. We can also see the tooth displacement that it can cause to the distant places, the far off places. Okay. Next slide. Make it in a full show firstly, slide show. Please make a slide show. So character introduction, or in the story of Little Dentina and the Wicked Balloon that we are going to actually have now, is Dentoria represents the normal oral cavity environment. In the story, Dentoria is a place, okay? Rivogeneria is the dental follicular fluid and lining, which is responsible for the vitality or the protection of the newly formed tooth buds. Okay, stars that are there in the river, they represent the stellate reticulum. Floods in dentoria that you will see in the later part of the story are actually increase in the osmotic pressure, okay, that is causing the cyst to form. The balloon sailor agony, because of whatever treatment he gets, is actually stimulus for the cyst formation, like the inflammatory stimulus or some obstruction along the way of the tooth. It is a gimmick for the balloon sailor agony. This is the balloon sailor with balloons. These are the floods in the dentoria. The magical balloon that the balloon sailor will use for dentina is actually the dentigerous cyst, and dentina is the character for the unerupted tooth. Okay, so these are the characters and the introduction of the story. And now I would like to request Bhakti to start with the cinematographic presentation and the screening of dentigerous cyst as a story.
Meanwhile, the technical error is happening. Just send me like anything that have you encountered dentigerous cyst or any oral pathologist during your clinic or during your clinical practice. Just put yes in the chat box. So guys, beat any pathology, yes. I received from Dr. Janvi, yes. Guys, be active. This will be one of a kind experience in the dentistry itself. Has anyone other person has encountered any kind of pathology during their clinics, during their third year, final year? Just put yes in the chat box. Yeah, good. Good, Kiran, Dr. Kiran. Okay, I'm receiving answers. Good, good.
Now can everyone, so sir, do we need to try it go for one more time?
Yeah, ma'am. Just try
Okay.
once. We're just switching off your cameras, and because that takes loader more bandwidth than the regular.
Yeah. So we will first begin the storytelling part, and then again we'll come back to the. So now we will start with the storytelling. Me being a kid, I always had a basic interest in stories. Okay, and stories I think are inseparable part of everybody's childhood. And have you all ever wondered that whatever stories we have, read or we have heard as kids, they always have a long lasting impact on our minds. The angel cocktail in our body gets stimulated. That angel cocktail is uh, dopamine, serotonin, and endorphins. Okay, so these are the hormones which actually get secreted in our brains. And what do? They start giving us long-term memories of it. Okay, we start feeling very much excited about the concepts. Hence, our attention span also increase. So that is how stories have a very, very good impact on our minds. Next.
Um,
So have you all heard the story of Hare and the Tortoise? Hare and the Tortoise is one of the stories that have actually made it to generations, and they have always been, a part of everybody's childhood. Correct?
sorry to interrupt, ma'am, but the presentation we cannot see. It's lost. And there is some glitches in the network as well.
Because of heavy rains and lightning, the city. So I'm so sorry for all the problems. Now is it visible?
Yes, Dr. Ketki, it's visible.
Yes.
Yeah,
Yes.
these things are bound to happen. Yeah, please go ahead. Yeah, carry on.
Yeah, yeah. So we were on the stories. Okay, so stories of the hare and the tortoise, which is generational value, and we know it that it already persists in our minds till date. So the power of characters on our minds is extremely powerful. Okay, and this fiction based learning that we actually do is it is such a creative way, as well as it is a powerful way of learning. Because now just imagine, so many people across the world, including Marvel, including Disney, have used power of characters, okay, to teach or to actually implement certain of their visions and certain of their moral in in every kid. Okay, all those stories and all those characters with which you and me as kids have most popular SpongeBob characters, okay, for whosoever you know, whether it includes SpongeBob himself, actually are the representation of the mental illnesses, okay, and the dramatic representation of any character actually comes from a disease, okay. Let's see how. And very naive reasoning, okay, and very limited problem solving capacities, very obsessed and controller of all disorder.
Yeah, so internet circuit down in the city. So uh, what we can do is, Bhuvan sir and Durga Prasad sir, I would like you to I would request you to please start with the discussion for today, so that I just hope the sanity of the Amravati comes back till then. So this is a very uh, very very upsetting situation right now.
Uh, don't worry, Dr. Ketki, these things are bound to happen at times because we don't have control over rainfall and other things. So these are bound to happen. No worries. We'll take the program forward. Yeah. Good evening, sir.
Good evening, Dr.
Good
Prabhat.
evening.
Good evening, Dr. Durga sir.
Yeah, good evening, Dr. I think I've been following Dr. Bhuvan for a very long time through LinkedIn.
Thank you, sir.
Yeah, I appreciate the work. POMPM form. Am I right to pronounce it?
It is, yes, Popma, sir.
Popma. Yeah, right. So I've been seeing great work done by your organization, connecting the practitioner oral pathologists across India, and it's a nice initiative. Most of us, as I'm the academician, to brief myself to the audience over there. So I'm Dr. Durga Prasad. I'm Dean for School for Dental Science and Technology, Malareddy Vishwavidyapeeth. To let you know, I am a periodontist who have done my bachelor's from SGM Dental College, Chitradurga, and master's from Annamalai University. I'm a periodontist. So then I worked for 4 years in India, and I was very much connected to the public health work because I was posted in community dentistry almost 3.5 years. Then we were allowed to do practice. Periodontists are allowed to work in public health dentistry. So during that time, I was very much connected to the community work, and I used to do a lot of camps and all. So during that time, I had started working on tobacco and oral cancer. So we run an NGO called as Narayan Seva Sansthan. So it's a group of dentists who initiated this, and we as an organization, conducted the longest tobacco awareness program in India in 2012. We started from Bangalore, and we went till Kanyakumari, and then we went to North and we came back. So we were part of an IDA event. They were collaborating with us, and Raja Rajeshwari Dental College, Bangalore was a partner, and we tried to map all the events. So there are a lot of stories to be shared. During our journey, we came across a lot of people who are habitual to tobacco, and because today's topic is like oral oncology, what are the career paths and innovation, what we can look in. So I just wanted to share like this is a brief thing which have come across, and that motivated me to be a trainer in TIA also. I was part of TIA when I was there in 2008 till 12 when I was in India. Then later on, move on to 1 year in Saudi Arabia, and I was working with Al Farabi. Then I went to 8 years. I was attached with Malaysia. I was working AIMST University, and there also we used to conduct few events. So there I learned few things, what are the good practices they're doing about the oral cancer and tobacco. As we know, like as a dentist, we're very concerned about this evil which is prevalent in the society, and we're trying to fight it back. And from there, I came back and I did my data science in AI. So that's how I started developing curiosity on image technology and image recognition. So I'm also working. I was working with Logi AI for some time, the oral assessment of the imaging. Then I also worked with Better Diagnosis. It's an radiographic assessment tool for IOPs and OPGs. Then later on, recently I've joined in January with the Malaradi Vishwavidyapit. We have initiated few newer courses that is related to what exactly we are talking about, the career paths and innovation. So that's a brief thing. And now I just wanted to discuss with Bhavan sir, like what is happening from their end, from the society, and what how we can guide the audience in the team, like what are the things we can suggest, like what are the career paths and innovation. So can you just structure the today's discussion, what we can have between us and the other panel?
So we can go like a panel discussion, dive into panel discussion, and we can share some light in the oral oncology thing that as a dentist or oral pathologist can pursue. Dr. Nagpal can share your experience in this field.
Yeah. I'll thank you so much, Dr. Bhakti Pramar, and thank you, Dr. Durga Prasad sir, for your kind words. And yeah, I'm also following you up on LinkedIn. So when I saw the invitation and I got to know that you are also one of the panelists, so I thought it will be great interacting with you. So myself, Dr. Bhuvan Nagpal, and I'm a practicing oral pathologist. The day I passed out, I had many options like to join to academics. I had 45 publications when I passed my PG, and I was a very anxious student. And what should I say? That A grade students, no, they always have a lot of anxiety. So A means A grade as well as anxiety. So that will come. So you know the scenario how it goes in today's world, the jobs and so many things. So the major thing which I relied upon, that we as oral pathologists read so many things pertaining to the general systemic part, including perio, including oral medicine. So we have to do some kind of innovation. So I thought that I should make my career. I was competent, like in my reporting part in histopathology, in hematology. So I approached diagnostic center, and it's a prominent one. I did bit of training there, and then I started. So currently I own four labs. One is I'm the director and senior consultant of Tohana Mangalam Diagnostics and Center for Oral Pathology and Maxillofacial Diagnostics, Hisar. So that particular unit is only for oral pathology related lesions, head and neck lesions. Then subsequently, I gained more of qualifications pertaining to administration, biochemistry, and even I'm a lawyer also. So because I have to head so many things, so I started with gaining more knowledge and studying side by side for all those. So I think just 1 year back only I've stopped. But apart from that, I keep on doing some other certification. So one thing is innovation. So I thought that when we see a lot of head and neck cases, and I should tell you that in India, we know that oral cancer is the most common cancer. Isn't it, Dr. Bhakti Pramar?
Right,
Yeah.
absolutely.
And you can imagine that very few, just single digit number, I can count that cancer centers, they have employed oral pathologists.
Yeah,
So
absolutely.
I made it a point that when so many head and neck pathologies are there, so why don't I should get into that part? So I got into that part. Then you just tell me that the blood which flows in our oral cavity, is it different than the blood which flows in the your heart or your liver or your arms? No, it's the same. but you will not take the blood from your mouth. No, you will not use the maxillary artery. You will use only the median cubital vein. So that was my thing. So how does it matter when a HB, if I'm competent to report as a oral pathologist, and HB will remain the same, whether it is done for tooth extraction or abdominal operation. So I started doing all that thing, and I'm proud to say that in India, I am the NABL authorized signatory as oral pathologist. I don't know whether I'm the first or not, but because of those documents, people have used. And since 2015, it's almost 10 years, I have done a lot of legal battle by putting RTIs and all those things so that many other people, because I talk about the Atmanirbhar Bharat. We know our honorable Prime Minister talks about. So I talk about Atmanirbhar oral pathologist. Why we have to be job seekers? We can be job providers. Then I initiated this part, Popma. Along with that, I have another 14 ventures. It's everything is available in the public domain, and I don't want to be apne muh miyan mithu like all that. So I'll just share a few slides of my PPT, and so that the students and the target the audience can be benefited from that. What all different career opportunities as oral pathologists can have in future, and it is just the individual's passion. And I should tell you, I don't belong to a very high class family or so. I belong to upper middle class family, and with scratch of the money I have made all these empires. And I just say, when I can do, why can't you cannot do? What separate what special is there? Only special is that I have that dedication and hard work. That when anybody will put into it, definitely will. The sky is the limit. So I'll just share that. Everybody can see my screen.
Yes, sir.
Can see, doctor.
Okay. So this was the thing. This is just one slide of the thing. We, as MDS oral pathologists, we are trained in general and special pathology, and we can be signatory. I have a lot of proofs pertaining to that, and it's available in the public domain. And there's so many things which we are also fighting on behalf of Popma. So these are the things that in 2017, when I wrote letter, it was being considered in 18. So MDS is being allowed as per the Ministry of Health and Family Welfare. And these are all our evidences. The DCI MDS regulations, BDS, even BDS internship regulations have that you should know about the hematology, you should know about the what should I say, the sputum and so many other things. And it is clearly written in our curriculum. Now, the what thing is, like, everybody in India, they have that, whether you have done BDS, MDS, you will be dental. What is this dental? Dentistry is a part of medicine, and this has been uh, a landmark judgment came in 2023 by Honorable Madras High Court that dentistry is a system of medicine, and you cannot exclude. So when a degree in medicine will come, what happened in Tamil Nadu, there were vacancies for food safety officers, and many BDS people have applied. Their applications were rejected. So what happened? They filed a writ petition, and in that writ petition, the Honorable High Court has told, the judgment was given that BDS is a system of modern scientific medicine, and you cannot exclude with that. And it is being taught in our like in MBBS curriculum also. So I have so many RTIs. So whatever is present in the Gazette of India, so that is like a law. And there's so many the NABL decision which is being granted to my lab, and I am being assessed by 15 medical assessors from pathology, from microbiology, from biochemistry, and so on. So they have like approved me. So now this was the thing which I wanted to emphasize. Atmanirbhar. Whatever the best thing is, this self-reliance. Instead of job seekers, we should be job providers. So, what can be the different opportunities as oral pathologists? They can open up their own labs, they can run their own labs. India is actually short of pathologists. See, there is a lot of disparity between the urban area and rural areas. I'm not saying that you go to rural areas, but when it comes to business, you have to always assess the revenue on investment, ROI. So you have to see where your scope will be more. Where already 10 labs are there, if you open up, so definitely competition will be high. So that is another thing which you have to see. Then you can be appointed consultant in diagnostic center. And it is not a myth. In our association, there are many people who are working as consultants. Then onco-histopathologists in cancer hospitals and oral cancer centers like Dharamshila, Malabar Hospital. Then this medical diagnostic industry has the highest CAGR report, which is around 16%. So they can be employed as quality managers, lab administrators, and even lot of derma diseases, they have oral manifestations. So as a consultant in dermatology clinics. Now they can be consultant. There are a lot of offline and online. I have a lot of my international patients who do not have access of like frequent consultations in the Western countries like US, Canada, UK, Australia, because the specialists they have to wait for 6 months to get that biopsy done or any consultation. So that also can be done. You can be a researcher in the ICMR, National Institute of Virology, IIT, even IIT and NIT has opportunities for BDS people. You can be part of embryology lab or stem cell research, pharmaceutical industry, forensic odontology, and medical publishing industry. Oral biology, again, a coming up subject, and it's already being a separated subject in Savitha University, and lot of dental material making companies they are taking up medical transcription. I think AI is going to replace online teaching is there, your conventional academics is there, medical insurance. I've enumerated all the things. It is your choice where you want to. Now, just I'll conclude that overlapping scope of practice is reality in this rapidly changing healthcare environment. No single healthcare professional can have exclusive role in diagnosis and treatment. The criteria related who is qualified to perform functions safely without risk of the public are the only justifiable conditions for defining scope of practice are suggested parameters. What happens, the medical people, they sometimes say, oh, he is a dental person, he does not know. You just ask any specialist who is MD, tell him that here is a pregnant lady, can you do a delivery now? See, lot of things will be written in curriculum. Even it is written nowhere implants are written to be done by BDS curriculum, but a lot of BDS people are doing implantology, isn't it? So you cannot always think that it was not in our part of curriculum. You should always be open to learn the things. That's all I wanted to emphasize. And competency is someone's subjective dedication and ability. It is not based solely on qualifications. And it's rightly said, Charles Darwin, survival of the fittest. So competent people will survive. And nutshell, oral pathologists are those qualified healthcare and lab professionals. They are authorized to sign lab reports and they can play a major and important role in medical diagnostic laboratory. Thank you so much. So I just wanted to say now when we all are living in an era where we use iPhones or any smartphones. I am not a propagator of any Nokia or iPhone, but why this picture is being put? Because see, this phone used to be popular at some moment of time, some 25 years back. But can you survive with this phone in today's era? No. So change will not come if we wait for some other person or some other time. We are the ones we have been waiting for, and we are the change that we see. It's time for change. So this is my self initiatives and request to the academicians that we should broaden up the scope of oral pathology, make it more comprehensive, practical, and we have to increase the interest of students towards the subject during initial years, and we have to create the awareness. That's what Dr. Ketki and his team, they are doing. They want to incorporate newer techniques so that the subject can be made more palatable, or what should I say, some may find boring, but if we associate things with that, so you will remember those things. So believe in yourself, your abilities, and your own potential. Never let self doubt hold you captive. You are worthy of all that you dream of and hope for. Thank you so much. I think it was a motivational one, so I don't think any questions or something, but whatever still they have anything, I'm open for any kind of questions also.
Thank you so much, Dr. Bhuvan. So it was truly inspirational presentation, and it was truly with the motivation. Dr. Ketki's network has come again now. So, Dr. Ketki, ma'am, can we start with your presentation?
Uh, Hello everyone.
Hello.
Now we have a. I am sharing the video, so please go through it.
Yeah. Okay.
Volume playing.
Voice is not there.
Okay, you can do one thing, doctor. You can play the volume through you can share the video on your laptop and play the volume on your phone, and you can keep both the things together.
Genoria was just not the life of the place but was a great tourist
Yeah,
attraction, and residents in
Yeah.
Dentoria used to take great
Can you
pride in their
restart, please?
river, and thereby the place became a major tourist spot. The minister of Dentoria thereby thought to create an amusement park to increase the cash flow and business for the town, and of course for himself too. For this, the minister employed number of craftsmen, chefs, and many other talents to develop a world-class amusement in Dentoria. Amongst all the amenities, the minister also gave a special invitation to a balloon seller from a distant place, whose fluidic balloons were known to fly to far-off places. Dentiture assist are balloon-like structures which are filled with fluid. The amusement park started to grow, and tourists all over the country started visiting. In no time, the fluidic balloons became the attraction of the place. However, every good thing faces certain challenge, and the same thing happened with Dentoria. One fine morning, Dentoria faced massive rainfall to such an extent that whole landscape started getting washed away due to rainwater accumulation, and the river Genoria faced floods, due to which water started entering houses and started causing huge devastation of the place. The minister of the town made immediate arrangements for relocation of people, especially of those who had come for running the amusement park. The minister relocated almost all the families, including his pregnant wife and he himself, but in whole chaos, minister completely forgot about the balloon seller. When lastly, minister was taking his full-term pregnant wife to a nearby place, he heard the balloon seller yelling on top of his voice, addressing the minister, that, "Sir, please save me. I don't have any place to dwell. The small tent that you have given me for stay is completely ruined and destructed." But alas, the minister was helpless at that point and couldn't help the balloon seller. Balloon seller, gasping in agony, thought wisely upon the present situation, and how can he save his life from the nasty flood. Suddenly, he thought of a plan to use his fluidic balloons to fly to a different location. Balloon seller filled up his balloon from the fluid of the river Genoria, and thereby the balloon took him to an adjacent town, where everyone from Dentoria had relocated. Balloon seller could not forget the biased treatment of the minister towards him, which might have cost his life, and the balloon seller's mind started getting mutated. Meanwhile, minister's wife went into the labor, and there was no doctor to make her deliver the child. The minister was begging the people to help his wife deliver the child, but unfortunately none of the folks knew what to do. Suddenly, balloon seller upfronted the minister and told him, "I can help your wife deliver the child, as my balloons can act as a suction bulb to pull the child out." Minister with folded hands requested him to do the needful with utmost care. Balloon seller, with his wicked plan in mind, although successfully, got little Dentina out halfway, suddenly filled the suction balloon with the water from Generia, which in no time got inflated to a large size and started taking Dentina away from her parents and slowly far away. Dentigerous cysts are caused by fluid accumulation in unerupted teeth. Thereby we use the gimmick of unborn child and once formed dentigerous cysts plus the unerupted tooth to distant boundary, for example lower border of the mandible or the orbital axis in case of maxillary cysts. The minister and his wife were left in shock and started trembling with deep sorrow about the incident that just happened. Minister started requesting the balloon seller to bring his daughter back, and with folded hands started asking for the minister's forgiveness about whatever the minister did to him unknowingly. Balloon seller's heart melted to see the agony and gasping tears of little Dentina's mother, and thereby he realized his mistake. Balloon seller asked the minister and his wife to stay calm, and with another balloon started fetching for Dentina. Soon he found the Dentina in the white translucent balloon enjoying the flight in the sky, and as he got close to little Dentina's balloon he chopped the balloon and grabbed the kid in his hands. Dentigerous cyst is removed by surgically removing the cyst. He returned Dentina to her parents, and later on the balloon seller went back to his hometown to stay happy forever after.
So
Yes, so I think uh, I mean with a lot of delay though, I think you might have got the gist of the screening. And as I had already mentioned about the characters, so I just hope this story through its character profiling, Dentoria, Dentina, the balloon sailor, the balloon taking Dentina to far off places, these all features are, to depict dentigerous cyst, its pathogenesis. And I just hope you would have liked the story. So I encourage every one of you to please give your feedback, as well as uh, just tell us how did you feel about the story. Anyone?
Everyone, you can
Doctor,
unmute.
I'll just make me a little bit interesting this. I think most of us are a little inactive. So just you start typing things. Whatever she asks, you just type.
Yeah.
You don't have to unmute. So you can type, and the person who is going to type the most will get the appreciation certificate from Doctor, I believe.
Yes, yes. And as I mean, sir, that's a wonderful way of doing it. Until till the time they drop their messages in the chat box, and we feel yes, we already have got messages. So, the storytelling thing, as we are already, have seen the presentation of it, and I was sharing the slide. So I wanted to tell everyone the same thing, that stories, may that be Alice in Wonderland, the Alice depicting schizophrenia, okay, in which there are a lot of hallucinations, delusions. The Queen of Cards torturing Alice. Okay, so Alice actually depicted schizophrenia, or may that be Scar from Lion King. Okay, we all have seen Lion King movie. So Scar character from Lion King actually depicts AHD, which is anti-social disorder, in which he likes to be a loner. Or may that be Ariel from Little Mermaid. She has a condition known as dysphobia. That means that, she doesn't want to dispose her things at all. She becomes very, very attached to whatsoever things she come across. Or may that be Hulk from Marvel. Okay. He also depicts the dissociative personality disorder, in which he is a scientist at one place and becomes Hulk. So all these characters, there are proofs in New York Times also, sir, that these characters have been developed from certain diseases, and that is how those all personalities of the characters have come. So when I was making two more, that wasn't in my mind. I just felt that every tumor is a particular character, and this was absolutely in contrast to what students used to come and tell me. They said that, ma'am, all pathologies are same, all tumors are same. We just cannot differentiate. They are very confusing. They are very dry. So I felt that every character, every pathology should be developed in that way or in that sense, which is easier to remember and retain for students. So I just hope two more concept has been made clear. And I would like to tell all the people, those who have joined, that please visit our website. Ishan, Papia put our website link in the chat box to see more of such blogs, more of such videos on our websites, okay? In which you can actually, we can make an impact on our end user of these pathologies. So what do you need to say? Yeah, thank you, Sakshi. So much, sorry once again for all the technical problems from our side. And thank you for staying up till so long. Uh, Coming to the hackathon thing also, I would like to make an appeal to all the students that we are hosting such innovation ideas on this platform of Popma, which is on 4th and 5th October. So if anybody of you is good with any of the ideas, they can come. May that be a research idea, may that be an idea that can get you into the entrepreneurship zone. We have a platform, a national platform for all of you for the guidance as well as mentorship.
Doctor, from here, I think you have set the platform right with your video and all. So, and you have an hackathon. So right now I can just get in if you give me permission, where I can give them some nice tea and snacks at the right climate time, which can, I cannot give literally physically, but I can give for the brain. Can I do that?
Yes, sir.
Yes.
Bhuvan sir, kindly allow Durga Prasad sir.
For
I will
He wants
just
to
brief.
share.
I just
He
two
wants to
minutes.
share the screen.
No, sir.
yeah,
I will
yeah,
not share
yes,
the
you.
screen. I don't share the screen. I just
Okay.
love to talk.
Okay, then to sir, of course,
Yeah,
sir,
yeah.
you
Okay.
need not even have to
It's
ask.
all yours, sir. Podium is
Yes,
yours.
Thank you.
yes.
Thank you. So, coming to the my experience and learning, as I said, like when I was working in Malaysia, I've seen one program which was run by the dental school over there. Like we had a program where we had trained our students to look at the landmarks where the cancer is very prevalent, like your gums, tongue, the floor of the mouth, and the gum, the palate. So these were the zones what we're looking at. So if someone is trying to look at some public health here, hackathon thing, what they can develop a quick recording, data recording device or an application where we don't miss out anything which we see through our eyes. See, most of our us are dentists, and most of them are like if we have general dentists or even oral pathologists, we are trained to see the teeth, not the soft tissues, not really into the soft tissues. Most of them we look at the white tissues, then the pink tissues, because that is what we miss out. So most of the lesions we miss out, and that is the scope what you can look in. Like if you look properly keenly into the softer tissue, we'll be not missing a lot of things. As we know, this is the sixth most common cancer which occurs in the world, and India is not exceptional from this. And 30% of cancers which appear in India are oral cancers. So we are dealing with such a situation where 30% of males are affected with oral cancer conditions. And most of the time, what will happen is the morbidity and the incidence is also high. And they say like around 350,000 new cases are reported globally. So this could create a little curiosity in the audience who is attending to look at. There's a lot of potentiality in exploring the oral cancer as one of the field when you're working on a hackathon related to oral cavity. And coming to the careers as such, you can be an academic researcher. I think Bhuvan sir has explained very well, like he was an interested person who wants to be in academics and he has done a lot of research. So one part is that you can do your, if you're a BDS, you can do your MDS and you can also finish your PhD program. There are a lot of postdoc fellowship programs which are run by various institutions. So, what makes you to be an academician and a researcher is that differentiate is that academician just does what he does daily and repeats the same thing. But when a researcher, he has a curious mind and he thinks about something new things, what comes to the whichever he sees. I feel a researcher should have one good character about researcher is his five senses should be working. That is, he should be able to see properly, he should hear things properly, and he should taste, or if you find any changes in any of these five senses, that means you're doing research actually. So this is one area what you can look at as a career path in oral oncology. You can be an academic researcher, and also you can be a clinical researcher. See, most of the time what happens is like clinical research is not much spoken, and this has a good potential in as a dentist, and there are a lot of openings for the dentist and oral pathologists uh, that can be explored uh, from career point of view. And I think most of the audience do agree that clinical research is another scope which we can look at, and most of us have been given openings in clinical research platforms also. So you'll in when you're a clinical research, you may work with, when you're talking about cancer, you may work with chemotherapeutic agents, radiotherapeutic agents, immunotherapeutic agents, or you can design certain protocols, or you'll be working with biomarker or validation. So these are the different things. And when you're working as a clinical researcher, I've not spoken much about the academic research because most of from the academic background, we see our staff working. We see many of them attached to being an academician along with research. But clinical research, you can explore other than the regular dental colleges and schools. You can also look at oncology departments, specifically medical oncology departments or hospitals where you can get tie-up, or you can work in specialty cancer research areas. And also you can work with research foundations. So this is one area what you can look at as an oral cancer specialist if you're planning to look into to explore. The other area, if you're good at uh, uh, what you can look in is like diagnosis and image specialist. You can work as a diagnostic and image specialist. Now the most happening buzzword is AI, right? So you can work with the development of certain diagnostic tools, kits, or even you can make a product of yourself, which is easily uh, uh, doable at your facility, or you can tie up with some other facility which could they can help us. So most of the central universities now they are welcoming a lot of young researchers and young startups, or if you have an idea which you are working on and you can tie up with that institutions. Even Malaredi encourages this. So you can look into some aspects of this, like you can go for optical imaging. You can do an AI assisted histopathological device or image recognition model, what you can work on. So when you are working in this diagnosis and image specialist, so you can attach with the diagnostic labs, like Dr. Bhuvan said, like he's working on diagnostic lab and he runs and he owns. And one good thing about this is that if you're working and got expertise to be a practicing oral pathologist, or practicing working with diagnostic labs, you will get you can be an entrepreneur by yourself. And also you can work with dental imaging centers. That is another thing. And you can have your own startup. And also one important thing what I've seen is that most of the startups, they work by making the product, but they don't even most of the time they run with small cohorts, and they validate their product. So my suggestion is that you can tie up with an NGO, or you can tie up with an IDA association like IDA, or some NGO associations where you can conduct cans for screening. So most of the time we miss these oral pathological lesions which are not being screened at the community level, and most of the models do fail in this aspect. And along with this, other aspect what you can look at is that you can be a public health expert. You can tie with an NGO, or can work with an NGO, just volunteering in screening, maybe doing some data examination, or even also jotting down the data, whatever is present, to just to know the prevalence and incidence. So if you're working on an idea, data recording tool could be a idea which you can work on. So that could be another career as an oncologist. You're working on oncology or oral cancer related field, and as a oral pathologist, if any of you are, you can look into just not only the slide aspect, you can also look into the public health aspect, which is not explored much. Seeing the prevalence and incidence and the other factors which play a vital role in cancer development. The other thing what I've seen is biotech innovator sector. A lot of biotech companies now, right, recently they are studying saliva as a tool of diagnosis. So this could be one area which you can explore, and you can work on certain ideas where saliva can be used and can be studied. And we have seen the COVID where we use saliva as the uh, diagnostic thing which we were using it and trying to check the uh, antigen antibody reaction and just shares a diagnostic aid. And along with this, because it's a non-invasive way of method of detection, so that can be done. And along with when you're working with a biotech company, you can also look at nanoparticle formulation, where you can think of some drug which has been incorporated into nanoparticles, and you're using as a topical application or systemic administrative modes that you can look at. The other area which is least spoke about when we are talking about cancer and other things is like regulatory and industrial roles. So support, you can be a support for as an ethical team or legal team, where you can attach with the pharma companies, or you can be a regulatory body person along who develops devices. You can attach with those companies who are working on device development. So these are the different scopes what you can look at, and you can design some protocols. Also, that is one of the thing what you can look at. So coming into key innovative oral cancer areas which are thrush and which are in demand right now is AI and digital pathology or photography, where deep learning methods are used to detect precancerous and malignant changes in the tissue. So this is one of the thrush area which you can look into to innovate or to work on. The other one is augmented diagnosis and augmented histopathology interpretation. Recently, we had one industry person visiting us, and they have seen that they're able to read the slide and record the findings in the of the slide to the microscope. So not only looking at single field or single area, they were able to record the overall slide, and that data was the video data was converted and were trying to be interpreted. So these type of models you can work it. Other one is omics. This is another new thing. What you can look at liquid biopsy. This is other area what you can look at. Like saliva is non-invasive method, and you can detect the genetical and proteinomic markers in this saliva. So this area you can look at, or you can also look at early stage non-invasive method of cancer detection. So these are one area is what you can look at. Uh, And precision medicine, this is another area what you can look at, where personalized treatment protocols can be devised when you do molecular diagnosis methods were applied and you try to analyze and understand. As dentist, when we are working on cancer area, the most potential area we try to underestimate and we try to overlook is 3D bioprinting, because most of the surgical procedures what we do, they undergo for resective surgeries. So you can look into where you can work as an 3D bioprinter, working on 3D bioprinting and oromaxillofacial prosthesis. You can try to work on, and also right now you have digital scanners which are trying to scan the intraoral defects and other things. So this is another area what you can look at. Uh, then other is nanomedicine and immunotherapy. So nanoparticles and immunotherapy is another area what you can look at. So whenever you're looking at these cancer as a base and you're looking at to work in the field of cancer, one of the important thing is that you should know biology. The next part is pathology, and when you are studying these two things, you should be also knowing about genetics, also molecular biology, and then you will be linking everything together. You can work on any of the field what I mentioned. And if you're along with this, if you have some knowledge on AI and ML tools, I don't say that as a specialist we have to learn everything, because it's not possible to learn everything. So you can tie up and collaborate with a person who is an expert in AI or ML, and you can work on your idea. In that way you can come up with some product which will be helpful to grow as an entrepreneur, or you can you can patent the idea, and also you can produce it in a large scale, and you can be a manufacturer of that product. So coming to the research aspect, the other big thing what nowadays most of us are working at the university levels, and also we are also working at creating databases. So you can, as a clinician, you can contribute to the database. We are like genomic data or imaging data or also pathological data. You can contribute your slides if it's your data and you're working on it. You can contribute to this. So coming to the career paths, I totally agree, Bhuvan sir, like what he said, and you can see one of the entrepreneur here who's already working on a model where she's trying to explore the possibilities of telling the pathology through a story. So this is one of the model what you can look at. So if you're thinking about anything innovative, if you think in the regular path and you be in the regular path, yeah, you will be doing the routine, the same thing, and that is a reason why most of us get we are not happy with the work what we're doing, and most of us not satisfied what we're doing. So if you're looking at something different, the hackathon part what they have mentioned, sit down, put your ideas, put your time, you can do some mind mapping, and uh, nowadays the newer tools like GPT technology helps you to find out, do a quick research, literature search. Uh, I feel like AI technology can be used in a better way. So why don't you lessen your burden by reducing a time of search and literature research and something? See, whenever we talk about research, most of the older school taught us that you have to go through, go the literature review, look at the shortcomes in the findings, find something which is missing in the journals or missing in the textbooks. But according to me, it's my personal opinion. Just open your senses. You'll find a lot of problems, and if you find a solution for those problems, you are an innovator. So with this comments and suggestions, whatever I given, so these are my observations more than suggestions. These are my observations where I can help you to guide to be part of this hackathon and contribute. Along with this, I also want to say that to help our dentists to be a part of research, our School of Dental Sciences and Technology, we have started an MSc program in oral biology and also MSc program in biometric regenerative dentistry. And this is a 4 years program. The last year will be research. All the 3 years you are attached with an industry. And last part of your second sem, like we have sem by first sem and second sem. The second part is you will be attached with an industry and you'll be doing your internship. And most of the tools, what happens is that most of your PhD programs, when you enroll yourself or when you're enrolling for your abroad careers, what happens is like they look at your skill set. So most of us are trained to be a good dentist as a clinician, but it's tough to get into the clinical practice abroad. So another easy method to travel abroad and try to explore your possibilities is that you have first-hand experience of research, learn certain tools, stick on to the tools, you'll get a possibility where you can be a postdoc or a PhD program abroad. With this skill set, we want to see that you are groomed and mentored at every level. We have a center research facility, and so we are also tied with a lot of industry partners. Dr. Ketki's company is also organization, and we also will be very happy to tie up with Dr. Bhuvan sir, because we are open to tie-ups, or we are open to the people who want to incubate at our centers, or you have an idea you want to work with us as a private organization. Definitely we are working in a different way where we are leading the dentistry. We're creating opportunities for the dentist, not the clinical practice, but also the research and innovation and being an entrepreneur and doing something good for the community and country as such at large. Thank you.
Thank you. Thank you so much, sir. Very, very vivid career scope. And now I feel that those who have heard you like till the end must will not complain about saturation, at least in the research field. What say Bhuvan sir? What say Bhakti? There are so
Yeah,
many
yeah.
opportunities. It's only that you should get connected to right people.
Yes,
Yes, that's right.
that's right.
Yes. So, any question from the audience? If you want to know, if you want to explore any particular thing, we have our panel for another minutes, couple of minutes. So, anybody has any question regarding career scope or anything? Okay, so with this, I would like to say that we all are a group now, and everybody is associated with us through this webinar. We have got along with many BDS students. So any mentorship, any guidance on whatsoever is your scope of work, we would be available. Thank you so much, Bhakti. Thank you. Yeah, we have a question. Okay. Yes, we have a Google form here in which we would like you all to express your interest regarding the upcoming things also. And please share your feedback. Sorry once again for all the technical glitches, and thank you so much everyone for your time.
Thank you. I would just like to say that as a BDS, I am also practicing as a dental oncology since 5 years. So there's so much opportunity and in this field in oral cancer. So guys, just broaden your mind, expand your knowledge, come out of that conservative path that after BDS you just need to open your clinic or just do this the normal clinical dentistry. No, it's not true now. So just expand your knowledge, explore many things like I'm personally very much inspired by Dr. Ketki ma'am that she's doing incredible work with the tumor and her innovations. So, and also thank you, Dr. Durga sir, for throwing so much light and your suggestions and advice after doing the dentistry. And thank you so much, Bhuvan sir. You all are such an inspiration for all of us.
No,
Thank you.
thank you so
No,
much.
thank you, Bhakti. And I would like to tell everyone that you can actually get in touch with Bhakti over an email. She has actually, one among the many students who have pursued dental oncology in particular. She is into treatment of patients undergoing oncology treatments. And the treatment needs for patients undergoing oncology versus the normal patients is quite different. And
Hmm.
India doesn't have many dental oncologists in particular. So sometime we can take a student gathering wherein Bhakti can share her exclusive cases, wherein
Yes,
certain cases of very exceptional cancer she has treated. I mean the dental treatment of it. So I'm extremely proud of you, Bhakti, and all the best for your future ahead.
thank you so much, guys. I have put my email ID. Any one of you want to know more about the dental oncology or my journey, please email me at this mail ID. Thank you so much, guys.
Yeah, and one more thing I just wanted to share, Dr. Ketki, and anyone who's scored good and who's uh, willing to join our master's program, MSc program in oral biology, or we also have digital dentistry as a program. So we are giving 100% scholarship if we find the top three applicants from whatever applications we get. We'll be giving
That's
100%
amazing, sir.
scholarship, 100%
Yeah,
scholarship.
yeah, that's
Yeah.
really nice.
So please share that link. I'll
Yes,
also share
definitely.
in different groups and all, because I keep on sharing all such. Okay, yeah, that's a good thing. And one more request and information for all the members that Popma is organizing its first national conference in the month of October 4th and 5th, and it's open for UGs, PGs, and professionals. So it will be a 2 day event, and you can present your posters. So it will be a very hatke conference. You will get uh, everything in that. You will have that
Yes, yes,
emotion,
certainly.
action, drama, and everything
Drama, everything.
like how you find in movies. No, so it will be like surgical thing, the treatment part, the diagnostic part, and research part. So all the aspects will be covered. And thank you so much, Tumor.
Doctor, can we have a collaboration because we have also working on with an MOU on one of the product like Veloscope. You must have heard about it, right?
Yeah, yeah, yes, well,
Yeah.
yes.
Hmm.
So they
So
want
we
to
are
do.
So we,
open.
Sorry.
we are open, and so I think once we call it a day, we can have a discussion in particular.
Okay.
So what say, Bhuvan sir?
Yes, yes.
Definitely.
We are more than happy, and we invite you, sir, to be part of Popma, because
And
our
everyone
thinking
out
is
here.
that oral pathology is not only restricted to oral pathologists, because as a periodontist you also see a lot of oral pathologists, because gingiva is also part, and you there's a lot of systemic and oral communication.
Correlation. Yeah.
So we already have a periodontist on our panel,
Great.
and Dr. Bhakti Pramar, you will be really an inspiration, because as an undergrad you have pursued dental oncology, and uh, you should come up and get a platform where people can take inspiration from.
Sure, definitely, sir. Would
So
like to
this is,
forward to attend the conference as well.
yeah, yeah.
Yes,
Thank you
yes.
so much.
So
Yeah.
I guess we can have a separate link, and thank you everyone, all of you. We can just leave now.
Yeah, thank you so
Thank
If
you.
much,
everybody can
guys.
put on their cameras, we can like.
Yeah, but there are like
Put on
now
that.
the less people are present. Okay,
No issues.
just put on the camera. Has everyone put on their cameras? Yeah.
Okay. Shall I click one?
Yes.
I think people are,
Yeah. Yeah.
yeah.
There's a lag. I think.
Thank you. Thank
Thank
you
you.
Thank you
all.
so
Thank you.
much.
Thank you, Dr.
Okay.
Ketki, Dr.
Thank
Bhavan,
you
and
all.
to Bhakti. It's nice to know about you. Thank you.
Thank you as well, sir.
Yeah. We'll be in touch, sir.